Greetings and welcome to another episode of Heart-Centered Wellness Mental Health Mondays. I am Reverend Dr. Shalita Mira, the owner and clinical director of the Heart-Centered Journey Counseling, Coaching, and Consultation, where we focus on all things mental wellness. Each Monday, we bring you educational tips as resources for your mental wellness. And today's topic is Seasonal Affective Disorder. Fall, for some of us, is our favorite time of the year. It's full of beauty. The trees change shape, size, and color from the dying and shedding of the leaves. We see so much around us changing, from the vibrant greens to the dying oranges and yellows. The weather is cooler, meaning that we begin to spend less time doing those fun summer activities and may find ourselves spending more time alone. Fall brings spaces for rich contemplation and introspection. With the changing of the season comes the space to reflect on life. Watching nature transform motivates nostalgia within us. As life begins to slow down and we spend more time alone, we reflect on life, wondering what lies ahead, while some of us grieve the time past. For others, fall is the onset of one of the most complex times of the year. This is those who struggle with seasonal affective disorder. Seasonal affective disorder, or known as SAD, is a type of depression that's related to changes in seasons. SAD symptoms typically begin in the fall and continue into the winter months, sapping your energy and making you feel moody. These symptoms often resolve during the spring and summer months. Less often, SAD causes depression in the spring and or early summer and resolves during the fall or winter months. Signs and symptoms of seasonal affective disorder may include feeling listless, sad, or down most of the day, nearly every day, losing interest in activities you once enjoyed, having low energy and feeling sluggish, having problems with sleeping too much, experiencing carbohydrate cravings, overeating and weight gain, having difficulty concentrating, feeling hopeless, worthless, or guilty, having thoughts of not wanting to live, appetite changes, tiredness, insomnia, agitation, or anxiety. It's normal to have some days when you feel down. But if you feel down for days at a time and you can't seem to get motivated to do activities you normally enjoy or are part of your routine, then that is a warning sign, and it should motivate you, or if you notice these warning signs in a loved one, to seek the advice from a healthcare provider. This is especially important if your sleep patterns and appetites are changing and you're turning to unhealthy coping strategies like alcohol or drugs for comfort or relaxation, or you're feeling helpless or hopeless and having thoughts of suicide. If you are having any of these symptoms or warning signs, please reach out for help. Successful treatments are available, so you want to make sure to reach out to the appropriate supports. Coping strategies for seasonal affective disorder include self-awareness, meaning that we have to spend time in introspection, understanding that something about us is changing. And it helps when we know the warning signs of seasonal affective disorder. We want to meet with our doctor and or therapist to discuss the changes in our routine, our self-care habits, our normal daily rhythm. Phototherapy is one of the therapeutic modalities to include psychotherapy or talk therapy to help with seasonal affective disorder. Spiritual practices to include prayer and meditation, prioritizing social activities, making sure that instead of withdrawing, we are intentional about finding outlets and support systems that can nourish us and that can also recognize when our normal daily patterns are changing. Create a healthy routine. Exercise. Vitamin D supplements are very important during the fall and winter months because we're indoors more and our natural source of vitamin D is the sun. So supplement with vitamin D and work on healthy eating habits. Remember, what we eat or ingest becomes a part of us. There are antidepressants that are available for significant or severe symptoms of seasonal affective disorder. Take vacations. Yes, it may be cooler or colder outside, but we can bundle up and still enjoy the beauty of a vacation. Journaling is also another coping strategy that you could use, and pets. Pets are very important supports for all individuals who are struggling with mental illness, but especially seasonal affective disorder because of the isolation and social withdrawal that sometimes accompanies this disorder. The goal is that you practice self-care so that you can enjoy your heart-centered journey. Remember that you have been given a gift. You've been given a gift of self, and you've been given the gift of choice. Remember today to choose you, to choose health, and to choose love.